true. So in many ways, you are lucky. You still have relative freedom, and keep it like that. You can buy over the counter certain minerals, vitamins, melatonin. We can't do that in Europe. Our health are bound. We are getting them from you. So please keep up and keep your freedom. Do that. This is my number one thing. On the personal note, Lee and I, we know each other for 4 hours, which are in anti-aging medicine. It's just 20 years. We don't change, do we? Which will give you also a hope. Believe it or not, when I started this career, and I have been working in the pharmaceutical industry, it doesn't sound well to you, but I was actually invited to Astra Pharmaceuticals to rescue one of their drugs, which showed serious side effects. So they have made the first position of clinical immunotoxicology in Scandinavia, and the year was 1976. And at that time, I became board of basic immunology, which I have done at University of Stockholm. And that was something new. It didn't exist. I always have been challenged by things which nobody else did before. So I took the challenge and I built up the group of immunotoxicology and toxicology laboratory. So I was not employed to develop drugs. I was employed to look for side effects to make the drugs more safe. And on the way, I rescued the Losec, which became Triosec or omeprazole, and it became the locomotive which just driven the Astra to the big one. And as a thanks at the beginning, I got free hands. So I actually could play around without doing any boring things like toxicology studies. And it just happened, as it always happens, that sometimes during your life, there's a coincidence jumping in, and you get opportunity. And believe it or not, I was always working at the Tox Lab. I was always thinking about, my brain, I could do quite a lot of things, but I really don't know what to do. I was waiting for something, and I was laughing at home and saying, this is true, to my family. I just wondered when I started to live. I was 40 years old. I didn't know what I was waiting for. At the moment when I came to Astra, I still didn't know what to wait for. I had developed a test to diagnose side effects of drugs because I was asked if I could develop a blood test, a modern type of testing to see if workers working in industry exposed to different drugs, if they can be diagnosed and one can find the trigger. So I put around and looked on the workers which developed eczema, rhinitis conjunctivitis, and their colleagues which were exposed by the same way, but they did not. They stayed healthy. So I had sort of human guinea pigs, exposed and non-exposed. I had access to their blood, and after 10 years and several publications in major peer-reviewed journals, MELISA test has been born. And then came the opportunity. I knew it should come, but I never knew what it was. And that was when my co-worker, dermatologist, Margit Forsbeck, which was hired by Astra to do patch testing on his workers, and when I asked her, what should we do now which would really make impact on humanity? And again, the rhetorical question to good friends, which you actually don't expect any answer. But I got an answer, to my surprise. And she said to me, Vera, this is this thing, this mercury allergy. As a dermatologist, it just happened that she was the referral dermatologist for people which were at that time, we are now 1990, called oral galvanists. People who they had a sort of electric current going on between amalgams and gold and other things, and they were not feeling well, they were sick, and they were sent to my colleague, and she did touch testing. And she told me like that, Vera, we don't even know if the mercury allergy exists, because if we put it on the skin, it will be red. And we don't know, is it toxic, is it irritative, what is it? We know that there is a type of allergy, and this is so-called oral lichen planus, which is around amalgam fillings in the mouth. And when you remove it, it goes away. So if we could apply this test, this MELISA test, on the question, if there is something which is called mercury allergy, since everybody got mercury, this would be, in fact, this would benefit the whole humanity. And then I was thinking, well, let's try it. So we did. And we published in the first paper in a recent American journal, where it showed that people who had these oral changes had abnormal immune response to mercury compared to other groups which were at that time thinking that they are healthy, they tolerate mercury. And these were people which were amalgam-free and so-called, among others myself, healthy amalgam bearers. Call them like that. Now we know, and very soon, that such a thing does not exist. There is no one healthy amalgam bearer. And you know that as well. So even if you are asymptomatic, sooner or later it will get you. So don't worry about that. But the point was that you have to demonstrate it. It's not enough that you say everybody is mercury toxic. Because if you look on different other tests, laboratory tests which are used, for example, provocation tests, and you will apply this provocation test to 100 asymptomatic metal amalgam bearers. All of them will show the same concentration of mercury as the one which are there. So the authorities, the ADA, say, oh, you are charlatan. There is, of course, nothing like that. And they will never ever tell you the fact that mercury is very strong sensitizer. The fact it has been published in dermatology, which is very well known to dermatologists, that thimerosal, which is alkaline mercury thiosalicylate, organic mercury salt, is #1 allergen in children and adolescents in America and elsewhere. Did you ever heard this in risk evaluation of side effects of mercury additives in vaccines? No, because they don't want to. So the role of cellular hypersensitivity, which I'm going to talk about today, has been basically hidden because it's not good to see. So, getting back to these, we have been going on, and then we resurfaced or got together last year at the Lyme meeting, and we updated, and it ended up with me standing here, and we will hear more about this direct connection between mercury and other dental metals and inflammation, and the way how you can directly test what is the trigger of the inflammation in your patient. And it will not go only for mercury, it will go for other metals, it will go for gluten, it will go for mold, it will go for Lyme disease, and so on and so on. So let's see how much time we have. Thank you. Okay, sure. Can you do it? Okay.
So John is over there. That was good.
Okay, don't forget to eat. Many things you will already know, and some things I hope you did not hear at all before. And this is why we are here, so sort of fill up the gap. So this one, of course, we know, and we have been already talking about it. The causes of inflammation are also pretty well known, and mainstream medicine has been trying really, really hard to identify different causative agents in the field of microbes, bacteria, and viruses. Somehow, this so search or hunt for triggers of inflammation in most of the chronic degenerative diseases. For example, fibromyalgia, chronic fatigue syndrome, ME, MCS, or multiple sclerosis, Alzheimer, rheumatoid arthritis. Looking on the bacteria, the results are quite bleak. This is what we can say. Even in cardiovascular diseases, if you are looking now in the arteroma and see if there is a microbial or bacterial DNA in situ, it could explain inflammation. Yes, there is, but you can never ever cultivate these bacteria. For some reason, they are dead. While what we actually find, which I will talk about, is that you do find other things there. You do find metals there. Okay? So let's look on these substances which are now set in green, and this is lime, and on metals, and see how they can go together. This we have also seen before, you know this. And distinguished speakers before me said, which is absolutely true, that since the symptoms here are actually a result of cytokine production by inflammation, they are very non-specific. And all other symptoms of unclear etiology, like chronic fatigue, fibromyalgia, ME, CFS, have the same symptoms as well as cancer. If you read the literature, you find that cancer, you have abnormal fatigue. You have abnormal fatigue as a case of multiple sclerosis, SLE, rheumatoid arthritis. Why? Because cytokines will deregulate HPA axis, and I will talk about it. So what we have done, first of all, is that Dr. Elizabeth Valentine Toll, the one of our co-workers in Inventor laboratory, has developed MELISA test for life. So she was the one in Germany which first time, this is just several different studies which have been previously done, and what did they show? And it's up here with the publication of Dr. Valentine Toll, so showing that with the use of 8 different recombinant allergens from the lime, now including also 4 species which are here common in America, which is streptococcus, you can actually get very highly specific diagnostics. And neuroscientists lab here are presented, and they will be happy to tell you more about lime, MELISA lime, which they ran as well, together with metal testing, and Elizabeth Valentine in New Jersey. She does that too. So, what is MELISA assay? Well, it's a rather regular or standard test which measures memory cells in vitro. And memory cells are mainly driven by T cells, time-derived lymphocytes. They are also B cells there, and they are also induced by metals, no doubt about that, but it's a minority. Okay? So what you do with MELISA test is you ask the question, you ask your immune system, hi, do you remember this guy, this lime antigen? Did you talk about it, and not only you remember him, did it disturb you? Can your immune system react to it or not? And the truth is that in all environmental agents, for example, take metals or formaldehyde or other low molecular molecules, we are very happy, many of us, that our immune system is a bit sleepy. It does not recognize these low molecular substances when they are presented in the context of HLA. But, however, there are some others among us which have very active immune systems. And this all depends on the genes, and in animal systems, for example in mice, you have animals which have this key immune system and other ones which have this lazy immune system. In case of cancer, it's of course very good to have key immune system. In the case of allergy, automatically it's not so good. But anyway, so what you do is you draw the blood, you give the patient questionnaire, everything goes on our website, and you ask for exposure to different metals. And then, from the blood, you get answer if your body did react to these agents immunologically or not. So the body tells you, on the lymphocyte level, through your immune system, the same as you remember in the brain. So you have two different systems of remembrance, one on the immunology side and one on the brain side. So you draw the blood and then you bake it up and cultivate in laboratories with different concentration of different metal salts. If you have the patient which suspect it's mercury or gold or titanium, or if you have patients with GI problem, you can test gluten or gliadin, you can test candida, of course this is very often overgrowth, and you get yes or no. Memory cells are there or not. This took about 10 years at Astra to develop this test, and publish it took another 3 years and 10 years and so on. This is quite difficult thing, but now it really works. I will not go into that, they are just, everything has been published, and Valentine George compared it with other testing, so this we don't need to do. This is the testing we have in Europe. We do tests for different fragments of arsenic and garlic strains, because these are European strains. But in America, and this has been published, everything is again on our website, reproducibility, specificity, and this I would really, really ask you to do. If you are going to spend valuable money on you, or your patients, or some insurance company, please do not do tests which has not been published in peer-reviewed literature. There is, for example, Clifford's biocompatibility test, used also by Carl Huggins, who claims that he measures something which is clinically relevant. He might do that, I don't mind that, but there is no scientific publication. And unfortunately, metals do not cause antibodies. They don't form antibodies. So to use serum for measuring something, it's against the rules. You can't do that. I love House, and it's no problem that he's a pioneer. This is okay. But you have to play according to rules. And this is why I'm here, and this is why I'm so happy to reconnect with Lee, because he understands that if we want to spread our information, not only to 5% of all integrative medicine physicians and dentists, we need to publish in peer-reviewed journals. And once we do that, we will have 60%. We will have 75%. The window of opportunity is here, but we have to play according to rules. We can't change the system without that. So please remember that. So this is MELISA testing in the USA. Again, I will go very quickly into the results. This has been published in a paper, a small paper, and presented by Valentine George on one of the ILAS meetings. She tests again 8 different recombinant allergens and finds that 60% of US patients has been positive to stricter strains, but none cross-reacted to these other two species, which is remarkable in itself, because it means that at the T-cell level, there is no cross-reaction between the diagnostic strains, meaning, very interestingly, that it could be sort of perhaps develop some sort of vaccine, whatever like that. Here is the application why MELISA is actually much more sensitive and clinically relevant than antibody testing or PCR testing, because T cells are coming after infection in principle very immediately. And then if you kill them off, the T cell response will go down, while if you look for antibodies, they come later and they stay later. So doing the MELISA test can actually show you how to treat and if your treatment has been successful. So this is European patient which developed the typical erythema migrans, was positive in serology, ELISA was positive and MELISA test, and was treated, and then the treatment was successful and he became asymptomatic. And as you see here, before there is a reaction to several of these antigens, and after follow-up shows zero response and improvement in the health. This is case 2, quite simple, a little bit different, but in that case, amoxicillin treatment did not work, and the patient still have clinical symptoms. So they redone the test, and you can see that not only that it didn't disappear, but actually it's still here and it increased, meaning that the treatment has not been successful. So what they did is that they changed the medication. Now we are working with pharmaceuticals, but you can as well work with leaves if you want to prove it or to prove your point. And we have the paper on that, and then you can see that this one works and the patients become healthy. So this is something which you absolutely have to think about, that the tests which are ordering has to have clinical relevance. Because if you don't, you know that in mainstream medicine, many that have no clinical relevance whatsoever, they are just ordered because there is nothing else. For example, like ELISA testing for Lyme, it's just for nothing. But you should be better than that. You should be able to do testing. For example, why not? To do hair analysis, to see secretion of the mercury or other metals in children. And then give to children very mild detoxification. Just support glutathione, the C-vitamin, orally of course. And then to see that mercury levels go down. This is okay. But you have to show that improvement in symptoms correlates with laboratory tests. Otherwise, why should we do the test? We can do physiology. So, what we have seen, because we have done some studies also in Sweden, and what we have seen is if we take patients who claim they are sensitized or they are affected by Lyme and they have all these multi-symptoms, and you do MELISA test to Lyme, 80% will actually not show anything. And there are two explanations. One is that, as we say, they got hidden, embedded, and they are not immunology active. But the second thing is that, which was already mentioned here before, that it's actually something else. It's some comorbidity here. Yeah? So what could it be? So what we know is that metal-sensitized patients very often show allergy to antibiotics. All of you have seen this. It's definitely so. And if you ask them, they say, oh yes, I am allergic to sulfa, or I am allergic to penicillin. What people don't know is that antibiotics like penicillin are transformed in the body to a chelator, which is called depenicillinating. So any sort of antibiotic therapy will chelate your patient. Okay? People virtually don't know that. If you look into the old literature, and old literature tells also something about the treatment of MS and rheumatoid arthritis with depenicillinating. And this treatment, which is still used in some places, Jack Brass use it, for example. It's very efficient to treat or to improve MS and RA. Why it's not used more? Because there are many people have a side effect. 60% have side effects after treatment with depenicillinating. And the side effects are virtually identical with the side effects of heavy metal poisoning. Okay? Meaning that what you do, if you protractedly induced by antibiotics, which you do by Lyme, you are actually chelating patients, and your multi-symptoms or your health fiber reaction, I don't say it's so, I haven't done that, but we could actually show if the health fiber reaction is caused by Lyme, because then it would go with MELISA up, or by something else, maybe by inhalation of heavy metals, who knows that? And that's why you also have the MSA and zeolite in your production, I know that. So this I would like to look more efficiently on. This is a fact which you probably never heard before, but this is very important. So, about the Swedish Lyme study which we have done, not yet published, 34 consecutive patients who call to our doctor and say, hey, I am so sick for many years charge testing to 5 different metals, which we know very often are causing inflammation and multi-symptom in this group of patients. And it was mercury, it was nickel, it was gold and palladium. And out of these 34, only 12% responded to borrelia, while 18% just to one, but 74% out of these responded to metals, showing that metal-induced inflammation can be a very significant comorbidity or the explanation of their symptoms. We can't say, because we were not able in Sweden to do chelation and to do other things. So we just tell you this is one possibility. And this is how it looked like, response to metals and response to the lung. Very often these people have clinical metal allergy, which you can easily ask by asking, do you tolerate cheap earrings, if it's a lady, or jeans buttons? So these are very simple questions which you can ask, and you see if there is already clinical metal allergy present. So exposure to metal is everywhere, and mostly it resides in your mouth. And definitely it's not only about mercury and not only about inorganic mercury. Even so, I agree that non-specifically mercury is a big offender. But on the other hand, you have hidden things like, for example, titanium here, which is pigment, which is hidden in the pills, in the food. It's white pigment, which is neurotoxic and which has prothrombogenic properties. And any of your patients which is taking drugs against cardiovascular diseases or against psychiatric diseases is eating daily polluted drugs, for example, even Parkinson drugs contain titanium dioxide. And this is probably the reason why sooner or later these drugs, for example, anti-Parkinson's drugs, stop to work, because the person's macrophages, reticular endothelial system, is completely overwhelmed by substances which will then indirectly or directly cause death of the macrophages in the brain, which are in this case neuromelanocytes. So neuromelanocytes in substantia nigra are taking up titanium dioxide, and by this they are killed. And what do you know what neuromelanocytes do? They do produce dopamine. Do you know what oligodendrocytes do in multiple sclerosis? They are also type of macrophages. They eat up not only bats but also metals, which go through blood-brain barrier into the brain. And once they do, they die. And you know what oligodendrocytes do? They produce myelin. So if you kill those guys because they eat up metals, there will be no myelin. It's so simple. Just look on Wikipedia what is there. And then it's written that substantia nigra means black, it's white. It's white when the baby is born. And then later on the stuff is accumulating, and the stuff is given to you and to your patient by pharmaceutical industry. Don't ask me if they do it on purpose. I can't say. But this is exactly what is happening. This is a nice picture, isn't it? It's courtesy by Dagmar Magnusson, which is a fantastic dentist, friend of mine for 20 years, and she can cure as any other multiple sclerosis, and this is from one single patient. Yeah. One single patient. You can see corrosion here. You can see the screw. Screws are from brass. They contain copper, they contain nickel, they contain everything. Do you know that America is one of the few countries which still allows to use nickel-cobalt crowns in the mouth with 75% nickel? Nickel is cancerogenic and mutagenic. It induces sarcoma in mice.